I'm at Interim Healthcare, which is right here in Brunswick County. The office is in Supply, but y'all go all over providing home care for people in Brunswick County. Isn't that right?
That's correct. We're a home care company, and we also provide supplemental staffing. Locally, we provide registered nurses, licensed practical nurses, certified nursing assistants, and personal care assistants to the community, and primarily in the homes right now, but we also have a supplemental staffing arm of our business that we provide the same kind of staff in facilities if they need it, both short and long term.
Okay, Lou, could you tell our viewers about how you got involved with Interim Healthcare? It's a franchise, but this is the Brunswick County location.
It is, yes. It is a franchise business, and the corporate office is in Fort Lauderdale, Sunrise area. And I worked for this company right out of school at UNC Chapel Hill. So this was my first job, and 26 years later was able to go in partnership with the owner and purchase franchises of my own across the state. So we have 12 offices now across the state of North Carolina, and Brunswick County is where I live, and the one that I have probably had the most interaction with every single week. I'm the owner of Interim Healthcare here.
Okay, and how about you, Suzanne? How long have you been working for Interim Healthcare?
Just over a year now. I moved down here from Connecticut and have been in the home care business for probably 30 plus years, and that included my own company that I started for 20 years and grew to a substantial size, and then just decided to move down here, move south, where I've owned a home for 10 years, and was here for a year, became totally bored, and started looking for something to use all of my past experiences with, and
this was right up your alley.
It couldn't have been a better fit for me. And
That's awesome.
It just happened by chance.
Okay. Yeah, tell me about the services you provide. So it's home care, but that includes many different services.
Right. Well, the services we provide are all levels of care in the home. So, for example, if you have a family member that's been in the hospital and you realize that when they come home, it's going to be a big challenge to take care of their needs, because as we know, sometimes people get discharged from the hospital a little bit sooner than possibly the family feels comfortable. Right. And so they can call Interim Healthcare, and we can take care of anything from just being a companion in the home, or we can do high-tech nursing. We can do dressing changes, intravenous lines, take care of those. We can even do chemo in the home when needed. So, you know, anything that can be done in the home, we can provide the staff to do it in terms of nursing.
So home care is your big thing, but you also do short-term staffing as well.
Sure, sure. If a facility, hospital has any needs, or a local facility that takes care of dischargers from the hospital, like when they go to the next level, then we can go into those facilities and provide staff to them. Sometimes they have a maternity leave, sometimes they have a turnover in position, somebody leaves the position and they just need somebody short term. Or, you know, they can be expanding, and when they expand, they need additional staff. So they can call us and we can provide candidates for them to select from and provide that need short term.
Yeah, Suzanne, tell me about the clientele that Interim Healthcare provides services to.
Well, most important part of my position right now is to develop the private pay, private duty business in the home, which gives caregivers a tremendous ability to keep their loved ones at home, as opposed to putting them in a facility. And sometimes that's the most appropriate way to deliver the home care, in the facility. But I'm finding in my 35 years of experience that people really want to be home and cared for in the proper way at home. And it's not for everybody, but it is a service that we can provide anywhere from 2 hours to 24 hours a day, and it makes that possibility real.
And Interim Healthcare is very involved with the community. I know you were telling me earlier about your connection with Brunswick Community College and the nursing program there.
Well, we work with all the facilities in the area. So we do recruitment across the county now, and in all the counties we work. The community colleges are certainly, and anybody who does training programs are certainly areas that we like to tap into. And we do advertising in the local papers. So if anybody's interested in coming to work for Interim and they meet our hiring criteria, then we'd be interested in talking with them about coming here. So we do that. We're very active. I'm very active in the Rotary here in the county. We like to support senior programs in the county and just clubs and in general, and giving back to the community some of the talents that we can share.
Yeah, and then the staff you have here at Interim Healthcare is very qualified.
Oh, some of the highest in the industry. Yeah, we once we hire them, absolutely. But on the softer side of that, when I joined our company back in 1982, the owner of our company had a philosophy which we've carried forward, and it says something like, if you wouldn't place them to take care of your mother, then we don't need them to come and join our company, no matter how good their credentials are. So, it's kind of the soft side of hiring. We want to be proud of all the employees that we have, and we have high standards and all kinds of drug testing and testing and criminal background checks. And, our people are out in the homes and out in the community. They're not here working with us. So we like to make sure that they're the best that we can find.
And Suzanne, would you be able to tell our viewers about why home care is important and why it's important to be thinking about it, even if you're younger?
Well, there are several ways that I find that most of our clients, when I talk to them, don't have the misunderstanding that Medicare pays for everything. Mm-hmm. Medicare essentially pays for nothing, and the cost of care is extremely out of the reach of most people if they don't prepare for it in their younger years, by way of either private savings, investments. And the most beneficial would be long-term health care insurance. I'm a very, very big advocate of that. I myself have a policy, and if you do purchase early on in years when you're healthy, the cost is prohibitive. Once you reach the age of 60 or over and you've had some medical issues, the cost can be prohibitive, but I think it's extremely important to plan for your later years.
And you're out here in the community in Brunswick County educating people on that.
Yes, that's a very, very large part of the way that I can add value to developing this clientele. Mm-hmm. I've got a broad background in insurance. I'm a licensed producer down here, and not that I necessarily want to sell insurance, but in order to understand it and how it works and explain it and educate people, it's very, very helpful. Just as my background in nursing and administration, nursing administration, my own home health care company for 20 plus years, and also I was involved in a lot of, after I sold my company, a lot of compliancy and regulatory work.
So you have a lot of knowledge that people can come to you about?
Yes.
Yes, and there's just so much to learn about home care that we can't cover in the time that we have together. So if anybody has any questions for either of you, how do they get in touch with Interim Healthcare, and where is your office located?
Well, our office is located on Highway 17, across the street from what most people know as the old hospital. Right. And our sign's out front, so it's easy to reach us. And you can also call us. Our telephone's listed and our website's listed, interimhealthcare.com, and you can find our locations there. Okay. Just also wanted to talk a little about, if I could, the veterans benefits that are out there for home care. A lot of people are not aware, even veterans, that there are benefits that they can get, and we take care of also a lot of Medicaid recipients and those less fortunate that have some type of benefits in the county. So, anybody, just don't hesitate to call us, and if you think you might have a need or there may be a resource out there that you haven't tapped into, please give us a call.
Okay.
I also just, if I can have another moment to let you know that being, always taking a holistic approach to home care in everything that surrounds and goes into it, the finances, the insurance, and what we can offer, who it's appropriate for. I've developed, Interim and myself have developed a very nice relationship with Helene Levy. She's a elder care attorney right here in Charlotte. And we work very, very closely together to provide educational forums. We have one coming up for Veterans Affairs and the new laws that are coming out. And in that way, we reach the community and it completes the circle of holistic care.
Okay, well, we're out of time here. We're actually going to be heading to one of your clients' homes and speaking with one of them about the services you provide with them. I know they have a great story to tell. Suzanne, Nettleton, Byrd, thank you so much for being with us on Brunswick Biz today.
Thank you for sharing.
And thank you very much as well.
We've been with Interim Healthcare now for about 2 months, with John being here at home. Originally, he was in a memory facility. I began to think about some alternatives and actually read an article in the Neighbors magazine, the local Neighbors magazine that comes out monthly here. And Suzanne Nettleton was on the front page with an article in there about how her whole life has been spent helping people bring their loved ones home and care for them at home. And I could not find her phone number, so I just rang her doorbell one day, and she kindly invited me in, and I told her the situation and that I was concerned that my husband had Alzheimer's and was declining, and I was not happy with having him in an outplaced situation. Immediately she went into high gear, immediately, and began the process of helping us bring John back home again from the facility that he was in. Soon Jody joined us, and it's just been such a wonderful experience in knowing that he's here in the home with us. This has definitely been a godsend for us in terms of being able to keep him here at home, where everybody who loves him can look after him.